Hi everyone, welcome back. So today I'm going to be talking about sports massage. I wanted to do this post because I think there's still a lot of people out there who kind of maybe get a bit fearful of having a sports massage. And I suppose particularly the first time they have one, it's sort of fear of the unknown. But I think a lot of people assume that, this particular treatment, they're going to go and have it and it's going to be really painful actually during the treatment. And, they kind of almost assume that they're going to come away feeling a bit bad and bruised. And also, subjected to pain afterwards. So now I think a lot of this, is sometimes due to the fact that it says the word massage. And, quite often when people hear that word, they automatically take that to mean a sort of relaxing spa type experience, which of course, sports massage isn't. It's a very different type of massage because it's got a very different, sort of intention to something like a Swedish massage, which would be used for relaxation. So that's the first problem, is that people think that sports massage is going to be a relaxing experience. But, partly that is the therapist's job to, to ensure that their client has realistic expectations from the treatment. But, quite often this doesn't happen. And so, as I said, people will go in for sports massage thinking, they're going to be nice and relaxed. And then because obviously they have unrealistic expectations, they then come out feeling like, oh my God, that was really painful, and they sort of consequently have quite a negative view because actually it was the wrong type of massage for what they wanted to get out of the treatment. And unfortunately, this sort of negative view of their treatment can then impact on other people who actually just really want to be pain-free, and who could really use a sports massage, because when someone has a negative view about something, quite often that can then cause a sort of a bit of fear in others. Now, if I think about all of my sports massage clients and think about sort of the feedback and reviews that I've had for those, certainly a lot of them, at some point during the treatment do find that it can be uncomfortable. But it's not the whole way through the treatment. It's at certain points where I will kind of hit a muscle that does have a problem, and so that's why it hurts, because you're sort of doing things to the muscle tissue that in its current state it's not used to doing. So yeah, people will find it uncomfortable, but there are reasons for this. But also a lot of those clients, they'll also say, oh, but I felt so much better afterwards. And, at the end of the day, that's the whole point of having this treatment. So, and also, the other thing is that while a lot of these clients do experience a sort of a DOMS-like aching the following day, usually for up to about 24 hours, 48 usually at the most, they haven't actually been visibly bruised. So it's really kind of like going for a workout at the gym, when you've had like a year or whatever out. It can be a bit of a shock to the muscles, that they're having to work so hard. And that's all it is really. And again, it really comes down to the therapist to, give the client realistic expectations about what to expect during the treatment and after. And if the client has that, then there's usually not a problem. So I'm going to really just attempt to explain why, when a client is coming in for, say, muscle tension and pain relief, they may experience some discomfort both during the treatment and also, in that 24 to 48-hour period following the treatment. So first off, I guess the first question is, does a sports massage hurt? As I said, some discomfort during the treatment is a realistic expectation. And if you come along expecting it to be, completely relaxing and not feel any discomfort, then yeah, you're going to be kind of disappointed. The level of discomfort will really depend on the client's honesty during the treatment. The therapist and client have to communicate throughout sports massage to assess pain levels, and in order to get a really accurate assessment of what the problem is, where the problem is, etc. So the client really has to be honest about how much pain they are experiencing. Me personally, I always work on a scale of 1 to 10. So 10, is sort of where pain is, really unbearable. And, for me, for a sport, I always say to a client, a 7 to 8 out of 10. Sort of within that is sort of the therapeutic level, if you like. But if it's hitting a 9 to 10 out of 10, they really need to let me know and be honest that it is kind of, they're not able to tolerate it, so that I can then obviously alter, maybe the technique I'm using or the amount of pressure I'm applying, so that they're not coming away, feeling, in a lot of pain or, with bruises. And I'd say, if clients are coming away with visible bruising, then that is actually poor technique, on the part of the therapist. So understanding your client's needs is essential, and I will make decisions throughout the treatment based on obviously the condition of their tissues and on their feedback about how sensitive, etc. it is, and sort of make decisions as to whether, based on that information, they can handle more pressure or maybe a different technique. So, but it's also important to understand that sometimes during the treatment, as a therapist, I need to cause a little bit of extra discomfort in order to release a tissue. But at this point there is constant communication with the client, and I explain that they're going to feel more discomfort and why that is. And usually you find if the client can understand why there's a problem or why something hurts, they're a lot more accepting of it, and their pain perception then may actually be a little lower, and they're more able to tolerate any discomfort. So sports massage really is, it's kind of a balancing act, between one end of the scale, applying insufficient pressure, which really is, going to bring no improvement to the body's structures. And then at the other end of the scale, you've got applying too much pressure, which can cause further tension, and also sometimes additional symptoms that they didn't have in the first place. We've mentioned about obviously being in constant sort of communication throughout the treatment with the client. certainly that also includes non-verbal communication. And what, usually sort of the first sign for me, that's maybe someone's finding it quite uncomfortable. Sometimes you'll see like their foot twitch, or maybe their hips will kind of rise up off the massage table, or quite often a common one is that they'll hold their breath in order to cope with the pain or discomfort. And this is really good cue that that the therapist can use in order to sort of make those decisions to maintain that sort of balancing act, and find that therapeutic level for your client. Now, each client obviously is an individual, whose body is, going to respond differently to a treatment than, another client. And there's a lot of factors involved in that. And so it's a therapist's job really to read that client's body, that individual body type, and adjust speed, direction, depth of pressure, the techniques that you're using in order to present, a therapeutic challenge, if you like, to the tissues, and also a therapeutic level of discomfort. So the reason the pain happens is it occurs when the tissue is resistant to change. So for example, if you've got a muscle that's been overcompensating for a past injury for quite some time, you have kind of muscle memory kicks in. And so, the longer a muscle has been like that, that becomes its normal state. And so it's then much harder and much more resistant to treatment. So it can take, that's why sometimes some things take, quite a few sessions to really kind of resolve the issue. And so, in these situations, the therapist must find a way, to release those tissues and change those unhealthy patterns, but in a way that is a bit more sort of gently persuasive to the muscle, rather than just sort of wading on in there and trying to force the muscle, to change, to change the state that muscle is in. And certainly there are a lot of other factors involved. So, as a therapist, we have to consider, environmental factors, biomechanical factors, which will certainly alter discomfort levels and pain perception. So this could be anything. It could be like diet, it could be medication, it could be stress levels, it could be hormonal levels, or, for women if they're menstruating. So many things will, affect their pain perception. So it's important to be aware of those as well. Now, I'm also going to talk about, post-massage muscle soreness. As I've said a little bit earlier, quite often with the sports massage, the clients can experience similar to like a DOMS type aching that you get when you've been working out in the gym. So yeah, similar thing with a sports massage. And this sort of post-massage muscle soreness certainly will highlight, those weak spots that can be then treated in subsequent sessions. So actually, that soreness can be quite informative, to the therapist. But as I mentioned, it can last for usually 24 to 48 hours following the treatment. Most clients find that they'll wake up, the next morning with some aches, which really tends to be determined by the type of treatment and the intensity. Certainly clients don't tend to get it with like a Swedish massage or even a deep tissue. And also, we talked about individual body types. So again, every client is an individual, and, their bodies will react in different ways. And also, the way, sort of how mobile they are, sort of for the rest of the day after the treatment, can also affect it. Certainly I wouldn't expect a client to go out and do a full-on workout, but just, keeping sort of moving around, nothing too strenuous, but, not just, if a client sort of has one and then goes home and literally just like sits on the sofa for the rest of the day, then they're probably going to find that, their post-massage muscle soreness is going to be at a higher level than someone who just, keeps moving around. This post-massage muscle ache, it's generally due, again, as we've spoken about, it's due to those restrictions in the muscle tissue basically being challenged, and obviously trying to reset, the muscle to its sort of default condition during the treatment. So that's why, because you're pushing the muscle tissue, sort of past its current limits. That's why you're getting that soreness. The muscles have to obviously be manipulated in order to not only break down and release tension, but, to release those sort of more long-term holding patterns that we've spoken about. And also, in some cases to break down adhesions and scar tissue from, sports injuries or maybe medical issues. And, this has to be done in order to restore that muscle to its, previous functional state. If the problem is chronic, it's going to require deeper work. And, that in itself will cause a bit more soreness afterwards. And, because when you go deeper into the muscle, and certainly a muscle that has been, in not a very good way for quite a period of time, you will find that it can cause like really small micro tears in the muscle tissue. And so again, after the massage, it's going to take a little bit of time for those micro tears to just heal, so that you're not aching. In terms of whether, this post-massage muscle soreness is detrimental to someone's health, it's only really possibly damaging if, if there has been severe pain during the treatment, which obviously then causes the client to tense up further. And if they're sort of spending the whole treatment with the pain level so bad that they're holding their breath the whole time through, then yeah, that can be quite damaging. But that's down to the therapist to really, as I say, look out for those non-verbal signals and adjust the treatment accordingly. Massage for pain relief, as I said, it often involves regular sessions. If you've had a problem for quite a long period of time, it's unlikely to be fixed in one session. So, but some clients, they just want that single treatment, whether it's, for financial reasons or whatever it may be. And so if that's the case, then, the therapist, to be honest, should probably use a lighter pressure, really just to relieve the symptoms, rather than to fully challenge those muscle patterns, because that is going to take more time, to achieve results with that. And if they're only going to have the one treatment, then, you're probably going to cause them discomfort actually, you know, when it's not going to make a huge difference necessarily to actually really changing those patterns long term. You know, and it can be frustrating to do that, because as a therapist, you know you can do more by doing regular sessions, but you know you have to fit with what what your client wants. Now, in terms of healing, you know, we talked about sort of the healing of those micro tears, and you know, healing sort of the pain patterns, as well of the client, that you know, with the reason why they've come for the treatment. Quite often, you know, healing pain means that sometimes it might get a little bit worse before it gets better. And this is because of, you know, just because of correcting those muscle imbalances. You know, it can take a bit of time for those to really fall back in, you know, into place. You know, you're going to be introducing new ranges of motion, breaking down scar tissue, you know, and these things, you know, they can cause, you know, some other symptoms in some clients that, you know, again, it just means that it's going to take a little bit longer to kind of fully resolve any issues. But certainly, you know, the more sports massages that a client has, the less post-massage muscle soreness they will experience. And certainly, you know, first-time sports massage clients, they are likely to feel quite sore afterwards because it's a new experience for their muscles. And also, sort of when it's their first time, you know, as much as, you know, as a therapist, you try to help them sort of set realistic expectations, it's still kind of unknown to them. So they still aren't entirely sure just how much discomfort to expect, you know, and when you're expecting a certain level, you know, you tend to kind of deal with it, you know, better than if it's just a complete surprise. So when when our clients experience this post-muscle massage soreness, how do we manage that? What can you do, you know, to sort of ease that? So when we experience pain, what happens is, you know, our brain receives various messages through the sensory, you know, neurons in the nervous system. And this can cause muscle guarding, which is basically where we subconsciously tense our muscles in order to protect the sort of painful area. And this can it can actually reverse the effects of the massage, which can potentially then trigger a new pain cycle. So yeah, we sort of need to obviously be aware of that, and you know, obviously sort of try not to sort of hold muscles and things like that. But certainly, in terms of actually dealing with that muscle soreness, probably one of the most common things that I hear a lot of my sports clients actually use and say that it's hugely beneficial is having a hot bath with Epsom salts. And also after the massage, just avoiding exercise. You know, you don't want to be doing, as I've said, a full-on workout. You just want to keep moving around, but not overdo it. And also maintaining hydration levels, you know, to assist with that detoxification process over the next 24 hours. You know, again, this can really help reduce that post-massage muscle soreness. And certainly, you know, I think probably anyone who's gone for a massage, quite often, you know, their therapist will say, oh, no, drink plenty of water, and that's why. But also the other reason is that actually if you're slightly dehydrated, this can actually increase muscle tension, which again can then cause a more painful muscle, massage experience. So yeah, make sure that you are drinking plenty. And, you know, certainly if the pain continues, painkillers, you know, just a sort of one-off dose, may help interrupt that pain cycle, and just sort of change the effect of those, you know, those messages coming from the sensory neurons in order to allow the brain, to sort of relax the muscles so that you haven't got that subconscious muscle guarding. So that may also help. But to be honest, you know, I've never had a client say that they've had to do that. So, but as always, the best way to ensure that you are not going to come away battered and bruised is, you know, to ensure that you're seeing a registered therapist, a qualified therapist, and one who is experienced in whatever your issue is. And also it's important to tell them if you are someone who is just naturally prone to bruising, or if you are on any medication, because some medications can also increase your chance of bruising. But, you know, absolutely, if you are someone out there who has not had a sports massage before and you're thinking about it, maybe you've had a sports injury, or you've just got a long-term health issue that's causing you a lot of pain and muscle tension, do try it. That's all I can say. And if you get yourself a good therapist, then, if you were to book in for a sports massage and, you find it too painful, a good therapist will ease off. And if it's still too, even a light sports massage is still too heavy for you, then, a good therapist will just take it down to a deep tissue, and there's not a problem with that. But yeah, so the important thing is, communicate with your therapist, do your research, find someone who's registered and qualified. And again, a good therapist is not going to mind you asking about their qualifications or their registration status. But yeah, it really is worth doing. So don't let the sort of little bit of soreness afterwards put you off, because if the reason you've come is for pain in the first place, is it going to be any worse than that? And if it means that you feel better, after that 24 hours or whatever it is, then, surely it's worth it, isn't it? So, so yeah, that's really it from me today on this subject. There will be more videos coming out. Do subscribe to my channel and you'll be notified when they come out, and you'll be able to see the numerous other videos I have already up on sports injuries, specific muscle groups, medical issues, mental health issues and disabilities. Any questions, feel free to comment down below, or you can contact me through my Facebook or Instagram, which I believe there are links down below, and I will answer you. So until next time, take care. Bye.